Peer Navigation program is a program which is specifically designed to support people newly diagnosed with HIV, those re-engaging in HIV care, or those at risk of falling out of care, to work alongside a peer to address some of those issues in terms of information needs and practical support. The specific needs that the Peer Navigation program responds to is supporting an individual primarily following a diagnosis, to help them synthesise that diagnosis into their life, to support them through information provision and linkage to care, and help them navigate the often very complex environment of HIV healthcare and management.
As a peer navigator, as the name suggests, it's a peer. So having HIV myself, been through the journey or the process of dealing with HIV, my role is to just walk alongside those that are newly diagnosed and help them and assist them in coming to terms with their status, leading them to GPs, to doctors, to specialists, to mental health physicians to help them work through it.
My name is Diko, and my role here is Peer Navigation Team Leader, and I'm also working as a Medicare ineligible peer navigator. Well, I came to Australia in February 2016 as an international student. 1 month after that, I was diagnosed with HIV, and I was very shocked and lonely, and I did not have any support network. QPP was there for me and gave me that support. When I saw that there's an opportunity to work as a Medicare ineligible peer navigator, I took that opportunity.
I've been around people with HIV for a number of years in my life. A lot of my friends have become positive over those years. And so I guess my main desire was to want to help people to give back to my community.
Our peer navigators are representative of the diverse lived experience of people living with HIV. We have a team of about 15 peer navigators geographically dispersed across the state of Queensland, and they provide a range of services and support to people living with HIV.
The thing that motivated me to become a peer navigator probably was the battles and the journey that I went through when I was diagnosed. I wish I'd had someone there to help me and to lead me through that process, or assist me and say it's okay.
The strength of lived experience that can help people who receive diagnosis like HIV is really important. I think programs like peer navigation is really important, especially for a stigmatized illness like HIV, because when a client is linked with a peer, that barriers of not being understood, of being isolated, can be addressed right away from the first day of their diagnosis.
I think one of the most important aspects of the peer navigating program is it really does empower our clients. It enables them to link with others that have been through similar experiences, and it also gives them hope and gets rid of the stigma and the fear and all those other negative aspects. And like I said, it empowers them and gives them the ability and strength to progress in their journey.
I think it's that our role has the ability to be very powerful in terms of advocacy. So a lot of people aren't that comfortable with health literacy and navigating the health system, and I think for some people to have someone there with them, or to help educate them in that sort of field, is really beneficial.
The Positive Action Community Grants for us is so critically important in that it enables us to leverage additional resources and funding to provide innovative and responsive services to support the needs of the population of people living with HIV.